The next one or two sections of a module are examinations that are comprehensive and often involve multiple exercises that require the learner to demonstrate mastery of the skills and concepts that are the topic of the module. There are two basic exam formats. If the exam involves contouring, then there's a separate section of the module devoted to the contouring exam, because this exam will be graded with a similarity metric program that measures how much the learner's contour differs from the author's. We continue to put a lot of work into improving the sophistication of the similarity metric program, because a contouring exam is a powerful tool to examine many kinds of radiation oncology skills, in addition to contouring regions of interest for conformal therapy. For example, radiation oncology educators are struggling with how to teach and evaluate diagnostic imaging interpretation, and a test that requires drawing the boundaries of structures is an excellent way to evaluate this skill. The same is true for evaluating physical examination skills in many parts of the body. Here's a clip that demonstrates a similarity metric exam. This is what it looks like after the learner enters the similarity metric exam, in this case for the module Contouring the Level 1 Nodal Stations. To save time, I've bypassed the intro screen, which gives instructions for the similarity metric exam and emphasizes these 3 points. First, once you start the exam, you have to finish it in a single time session. Starting the exam counts as an attempt to pass the exam, and you get only 3 attempts to pass the exam in each module exercise. If you can't pass the exam within 3 attempts, you have to start the entire module over from the beginning with the overview lecture, and you have to progress through the module in the required sequence to have a chance of getting a satisfactory grade or continuing education credits. In this movie, I've limited the field of view to the main portion of the browser window. The instructions for this exam were to contour levels 1A and 1B only on the patient's left side. So, after choosing the CT slice that I want to work on, I've chosen this slice through the middle of the submandibular gland because that's just my preference for where to start contouring the level 1 nodes. I've magged it up to what I want to work on and adjusted the window levels. Then I have to choose the region of interest that I'm going to contour first. So I go up to this region of interest menu and I make sure that I've chosen level 1B. Then I activate the window, activate the drawing cursor, and then I go through each slice drawing what I think is the level 1B station. And I can erase my contour if I want to and go ahead and draw it again till I get it the way I want it. And I'm going to go quickly for this demonstration. So I'm going to progress up or down through the different CT slices, just like this, going quickly on each slice. I hope I'm doing a good job. I hope I have studied my overview lecture and practiced carefully so that I can get an accurate contouring compared to my author's references and demonstrate that I know what I'm doing as I'm going inferiorly. I'm remembering my boundaries of the level 1 nodal station that I learned in this excellent education module. I think I'll stop there inferiorly, and then I'm going to go up and continue contouring here using the platysma laterally as my landmark, going superiorly, posterior edge of the submandibular gland posteriorly, almost to the top, 1 or 2 more slices. I hope I'm doing a good job. I can see my anatomy very well, so I'm confident in what I'm doing. tools are easy to use, so I'm going smoothly. Now as I get to the superior edge here, I'm not really sure if I'm doing exactly what I should be doing, and it's hard to know where to stop, but I'm going to stop at this level. I'm checking here. I don't think level 1B continues this high, so I'm done. Now, if I were actually taking this full exam, I would then go up here and choose the level 1A station and draw that. For the sake of time, I'm not going to do that. I'm now going to go ahead and decide that I'm confident in my contours and I want to submit them for my grade. So I go up here and select the Leave Similarity Metric test. It gives me a window that gives me another chance to back off and go back and edit my contours if I want to. I'm going to go ahead and say that these are my final results, so I'm going to select Submit Final Exam Results. This is the results window, and the learner does not have to get feedback on their results, but most learners want to do this, and it's an important part of the education process. So even though the contouring results have been recorded and are final in terms of determining if or not the learner has a passing grade for this exam, now the education module provides feedback to the learner on how their results compare to the author's contours. So I would like to look and see how my contours compared and get my grade for each individual region and each individual slice in some cases. So to do that, I look at this window and I first have to select the region of interest that I want to look at. I'm going to look at my level 1B contour. I click on slice once to order the contours, and these are the slice numbers, meaning the level. The first thing that most learners do, and that I do, is look at the bottom line. This average score gives my overall grade for this region of interest. It says 79.7%, basically 80%, and 70% or more is required for passing, so I know I've gotten a passing grade for my contour of this region, but obviously I'd love 100%. So different learners use this information differently. I think what most people do, and what I like to do, is go to this column on the right, which gives my contouring similarity metric score for each slice level. And I see that on slice number 75, I scored a 79.5%, and on slice number 70, 85%, and so on. So to see how my contours differ from the author's, I then click on this button at the bottom, View Contours. The author's contours come up as a color wash, and because I've done a good job, my contours match almost exactly the author references, and you can see that the author's contour is this color wash here, and so my contour extended a little more posteriorly than the author's did, and that's the reason that I didn't get a perfect score on this slice. And so on. I can just page through. Here I did a perfect job almost of matching, with the exception of these very small areas of discrepancy. Here there's just a little discrepancy there, so my contours are matching very well. If they didn't, there would be a big area where the color wash extended outside of my contour. And so that's the way I get visual feedback, as well as looking at those quantitative numbers. That ends the demonstration of this contouring metric exam. The second exam format is the standard multiple choice text question. All modules have an examination with text questions, so the modules that have contouring have two exam sections. This is what the window looks like in the text question exam. At the top is the title of the module, which in this example is Introduction to Nodal Stations of the Head and Neck. Just below the title is text that gives the total number of questions in the exam, which question the learner is now working on, how many points the question is worth, and the total points thus far. All exams have a total of 100 possible points, so the text question exams have a number of questions that divides into 100 evenly. We can set the passing grade individually for each module, but our standard is 70% correct answers, because this is what most continuing education programs use. In the main window of the screen, there is the text question and 4 possible answers to choose from. If the exam involves an image, this is displayed next to the question, and if you want to make the image larger, you just click on the image and it gets about 3 times larger. In the bottom left corner of the window is a box for the learner to select if they want to take a 15-minute break during the exam, but the learner must complete the full exam in a single timed viewing session because this is a requirement of most CME programs. After the examinations, the next section provides documentation of satisfactory completion of the module. This takes 2 forms. First is a certificate from our company, and the second is continuing medical education and maintenance of certification credit that is required to maintain a medical license. The final sections of a module are called resource material. And this is where the author puts documents in PDF format that the user may want to print out to study as they go through the module or download for future reference. All modules will have a PDF of the lecture images in this section, but this is also the place for summary tables and other useful study material. Every reference document is a separate section in this column, so that is why there are 2 reference material items in this example. I'll end this movie with a brief discussion of the individuals and groups that will become clients of the EduMod program. There will be 2 types of users based on who determines module content. One group are clients who want to pick from a library of modules that were previously created by our authors. And the second group are clients who want to use EduMod software to make their own modules, or who want to direct Radonki Learning Center authors to make modules with content that the client designs. We have a detailed list of modules that will populate the module library. The content of the library is organized similar to that of a radiation oncology textbook, with the main topic categories being tumor sites, but we also plan modules on topics like medical statistics, cancer biology, practice management, and multiple other topics that are independent of tumor type. The main client for our module library will be radiation oncologists and related professionals in active practice and in residency training in the United States and in other countries. This is a list of the main clients that will use the EduMod program to design their own modules. Residency training programs that want to educate and evaluate their residents with modules that are made by their faculty. Cancer research groups that need to train and certify participants on technical aspects of radiation therapy used in specific protocols. Professional societies that focus on education. Organizations that certify competency for medical licensure or other purposes. Commercial vendors that need to train and certify users of their equipment or other products, and the wide range of government and non-government organizations involved with cancer care in developing countries. This ends this overview movie. We hope it was useful to you and welcome feedback about how to make it better.